Welcome to Clyde House Medically Speaking. Each month, we'll explore a variety of topics to help you better understand certain medical conditions and treatment options. My guest today is Dr. Laura Ford-Mukkamala, a cardiologist with Great Lakes Cardiovascular and Clyde Health. In this episode, we'll be discussing heart disease in women. I'm Mike Hughes, and this is Medically Speaking. Welcome, Doctor.
Thank you.
It's February, it's Heart Month. We're here to talk about heart disease, especially for women and some of the issues that they deal with. So as we get started, if you can, tell us a little bit about heart disease. What is it? We hear an awful lot about it in medicine, so tell us a little bit about heart disease.
Sure. So heart disease is basically anything that is wrong with the heart, either structurally with the actual mechanics of the heart, or the plumbing, if you will, in terms of the blood flow to supplying the muscle, or valvular problems, or if you have it at birth, it's congenital in etiology. So most of what we discuss as adults is acquired heart disease. And that could be through lifestyle or genetic problems that lead to damage to the heart or setting somebody up for a heart attack.
Right. So we won't get into men and how stubborn they are about their heart issues and their health issues. Tell us a little bit about heart disease in women and what makes that so different.
Well, so if you break up the symptoms for heart disease, it's almost better to kind of look at it as typical symptoms versus atypical symptoms. And women are just more likely to develop symptoms that are atypical compared to men. So the typical is the story that you always hear about of somebody with an elephant sitting on their chest. They've gone outside, they've shoveled snow, they feel that elephant sitting on their chest, they call 911, they get rushed right to the cardiac catheterization lab and get an artery opened. For women, they are less likely to have that. Only about 1/3 of women will actually have those classic symptoms. Men can also have atypical symptoms, but women more likely to have the atypical. That would include things like nausea, shortness of breath, breaking into a sweat, feeling flu-like symptoms or severe fatigue that's unusual for them, feeling of anxiousness, palpitations, dizziness. Those are more of the symptoms that we'll commonly hear from women. Right. And women are more likely to say that they just knew something was wrong and they knew it was not.
They're willing to admit it.
Well, it's what usually brings them to the emergency room, but there might be a delay because it's not the classic symptoms. Right. So they may come to the emergency room, but it might be hours later when they just are progressively having more and more symptoms and worsening.
Is there a perception that heart disease is mainly something that impacts males versus females? And if so, with your patients, do you find females surprised that they have some sort of cardiac issue?
Very much so. So even if you look at data that's been, they looked at surveys with women and as well as physicians, looking at the most common causes for heart disease and death, and women were. And unfortunately, the majority would say cancer. And women with heart disease, they will die. They have a 1 in 3 chance of dying of cardiovascular complication. Every 90 seconds, a woman is having a heart attack in this nation. So it's definitely something the American Heart Association has helped bring more to light, but we are still way behind. Right. And even up till data that was published at the American Heart Association last year, we are still behind in diagnosing women in a timely manner, and them recognizing their symptoms and getting all the appropriate measures and treatments, both before and after.
We've heard about Buffalo and West New York being at higher risk for cardiac disease and vascular issues. What are some of the risk factors, particularly with women?
Sure. So when you look at women versus men, obesity and diabetes are really big players in increasing the risk for heart problems. Women triple the risk of having a heart attack if they have diabetes. Obesity has a big factor in playing a role in developing heart disease as well. So the standard risk factors are still very true. If you are a diabetic and a smoker, you've just increased your risk of having a heart problem in your lifetime manyfold. Blood pressure is still very important, though. eating a healthy, clean diet is important. So getting activity, trying to find something in your day that you've maybe put extra steps in, or if you can't get to the gym, trying to do something a little bit physical, because that is really important. Lifestyle modification can impact your risk for having heart disease substantially.
You mentioned it briefly before, but talk a little bit more about the warning signs for both heart disease as well as, potential for either heart attack or stroke.
Sure. So the warning signs for heart disease, you can have chest discomfort. And I like to tell people that if you're asked in the emergency room, do you have chest pain? Women will commonly say no. Because,
why is that?
Well, because pain is giving birth.
Okay, that's real pain.
So
all things
the perception is very different, and communication and how we convey that is very different. So I always tell my patients, if you have pressure, tightness, heaviness, burning, anything in your chest that does not feel normal, tightening, say no, but then explain to follow up what exactly you are feeling, so that physician or that provider who's evaluating you in the emergency room can then make sure they're still on that track of making sure you don't have coronary disease.
So do they confuse it with more of a discomfort or just an odd feeling? Because to your point earlier, pain tolerance is much different because of things like childbirth. So is it something that it masks itself, or is it just a different complication or type of pain?
It's just a different symptom, and we'll hear more of the same kind of symptoms from men, but they'll say yes to chest pain more commonly than women will. And so it's really important to make that very known that, no, I may not have what I think of as chest pain, but I am really tight in my chest right now, and this is not right, and I feel like there's something heavy, and really going into detail in terms of what they're feeling. And that emergency room provider is going to still listen to everything you have to say after that, because that's a warning sign that something is going on with your blood vessels in your heart.
I mentioned before, it's February, it's Heart Month. Do you have any takeaways for the women out there who may be watching in terms of heart disease and prevention or education?
Sure. So in terms of just to evaluate yourself every year. So make sure you get in with a good primary care physician who's going to sit down with you and go through your risk factors. If you have a history of gestational diabetes or blood pressure, that is actually a sign that is a risk factor for developing heart disease later in life. So it's important that you're getting your blood pressure checked every year, that you have your cholesterol checked as appropriate by the guidelines, that you're discussing with your primary care physician in terms of what you can do to make your risk lower. And then if you start developing symptoms, don't wait. Women are known to care for everybody else in the family first before they take care of themselves. The whole you need a stress test. Well, I've got to do this and this and I'll get to it. Doesn't work. You have to really put yourself front and center when it comes to developing these symptoms and getting this worked up.
Well, hopefully the awareness of it being Heart Month and it being February, and especially the focus on women's cardiac disease, will help that as well.
Sure.
So
absolutely.
Well, thank you for your time today. Appreciate the information.
Thank you.
Okay. I'm Mike Hughes. We'll see you next time on Medically Speaking.